Hello, my name is Dr. Frank Vandy. I'm a vascular or blood vessel surgeon. Today I'd like to talk to you about something very important to me, peripheral arterial disease, or PAD. Now you may ask, what is PAD? PAD, or peripheral arterial disease, is the term we use to classify blockages everywhere except those in the heart. It's a buildup of plaque in the walls of the arteries which reduce or sometimes block the blood flow to your limbs, arms and legs. However, PAD is most commonly seen in the legs. We see in this schematic an artery that's wide open on the left, and on the right, an artery that's blocked by plaque. Who is affected with PAD? Many people. PAD affects 8 to 12 million people in the United States, with some estimates even ranging higher, sometimes as high as 20 million people. We know that the risk of PAD increases dramatically with age. Some minority groups are more than twice as likely to have PAD. So what are the symptoms of PAD? The most common symptom of PAD is fatigue in the leg muscles, either in the butt, the thigh, or the calf. Most often, people experience this fatigue during activity, such as walking or climbing stairs. In moderate to severe cases of PAD, they'll experience fatigue and even pain in the legs that occur all the time, or even disrupts the sleep. In the worst cases of PAD, patients will develop sores or wounds on their toes, feet, or legs that heal very slowly, or may not heal at all. Other symptoms of PAD include color changes in the skin of the feet, having a lower temperature in one leg compared to the other, or poor nail growth. However, more than 50% of people do not have classic signs or symptoms of PAD, and 1 in every 20 Americans over the age of 50 has PAD. So let's talk about who's at risk for PAD. We know that the risk of PAD increases dramatically with age, and those who smoke or have a history of smoking have a very high risk of developing PAD. Diabetics have a very high risk of PAD, with 1 in 3 people over the age of 50 with diabetes having PAD. Other risk factors include high cholesterol, high blood pressure, being African American or Hispanic, and having a history of vascular disease such as heart attack and stroke. How do we diagnose PAD? The simplest way is just having a conversation with your primary care doctor. Ask about your risk factors and discuss your medical and family history. Another way is a physical exam. Your healthcare provider may check the pulse in your legs and feet to determine if there's enough blood flow. They'll look for the color, temperature, and appearance of your legs and feet, or signs of poor wound healing on the legs and feet. If your primary care provider feels necessary, they may order a diagnostic test, such as an ankle brachial index, which compares the blood pressure in the leg to the blood pressure in the arm. Additionally, they may order an ultrasound to measure the blood flow in the arteries and see if it's narrowed or blocked. Other tests include CT scans, MRIs, and angiograms. Once you've been diagnosed with PAD, the big question is, how do we treat it? There are 3 main approaches to treating PAD: making lifestyle changes, taking medication, and in some cases, having an endovascular procedure or surgery. If you do need to have a procedure, the first line is often minimally invasive treatments, such as plaque removal using a variety of catheters, angioplasty using a balloon, or a stent to expand a narrowed artery. Oftentimes, the surgical procedure is a bypass to go around the blocked artery. In the worst cases of PAD, amputation may be necessary. I hope this was a helpful explanation on peripheral arterial disease. If there's additional questions, I would be more than happy to spend time with you and your family in clinic. Thank you, and have a nice day.
Well, it started out, my foot was feeling, I was getting pain in the arch and the heel, and then in the calf on my leg. And the calf got really bad, and then I lost feeling in a couple of my toes. It was if I walked more than 20 feet, then the leg started hurting to where I couldn't walk, stand, or nothing. So I sat down for a minute. 25 feet. Yeah, I'd only have to sit a minute or two, and then it would start getting better, then I'd get up and could walk more. Started probably 3-4 weeks before I seen you, before I had the surgery, and it just progressively got worse. And every day it was worse and worse, and then we took a trip out to the Dakotas and came back early because I just couldn't ride in the car or anything anymore. Well, I had to slow down at work, and then it just couldn't do nothing around the house, wasn't mowing the grass or nothing. Actually, it didn't scare me because I knew enough about, what do you call them, the things you put in the leg, or stents, from the work I do. I knew with stents where I was figuring that I was going to wind up with one of them, but the idea of having surgery kind of scared me. I figured 6 weeks or something. It was immediate. Well, I walked all the way to the car when you were done, and that was on the other side of the parking lot, and it didn't hurt at all. Within 2-3 days, the numbness pretty much went away, and my toes, except I got just a slight numbness now in one toe, but it gets better every day. There's no pain in the calf. The foot feels great. I mean, it's been great because I'm working overtime now again and everything. The leg hasn't been bothering me. Wife and I are going out of town this weekend. We're already scheduled to go out of town again at the end of July, so. This time I'm really gonna quit smoking because not only you but a couple others told me if I don't quit smoking I'll be back in here in a couple of years. So. That's a lot better because you're not having something put in your body, you're having the problem taken out. So I've seen stents and everything, and no, this was a lot better. I really like this better. I would have got in sooner. So.